Have you heard of an inherited disease called spinal muscular atrophy? What are its causes, and is it curable? Well, we have the answer to all your questions here. But before we discuss them in detail, do subscribe to the channel and turn on the notification bell so that you won't miss any of our latest updates. Spinal muscular atrophy, or SMA, is a complex genetic disease that affects the skeletal muscle and the central and peripheral nervous systems. Given that most nerve cells in the spinal cord regulate muscles, the word spinal in the disease's name alludes to this location. Muscular SMA is the name given to SMA because it mainly affects muscles that do not receive signals from neural cells. Atrophy, the medical term for shrinking, is what happens to muscles when they aren't treated by nerve cells. The hallmark of sickle cell disease is the demise of motor neurons, which are nerve cells in the spinal cord. Then again, what causes SMA? The lack of a motor neuron protein known as SMN for survival of motor neuron is the cause of chromosome 5 SMA. It appears that this protein is required for proper motor neuron function, as its name suggests. A key function of SMN is to regulate motor neuron gene expression. Gene mutation on chromosome 5 in the SMN1 gene are the cause of its deficiency. A complete segment known as exon 7 is deleted in the SMN1 gene, which is the most frequently occurring mutation in patients with SMA. Due to their 99% identity, nearby SMN2 genes are partially compensated for non-functional SMN1 genes. Do you have any idea about the types of SMA? Well, here it is. Type 1. Type 1 is also referred to as an infantile onset SMA or Werning-Hoffmann disease, which typically manifests itself before the age of 6 months. The children who are most severely affected will have chronic shortening of muscles or tendons and decreased movement. Reduced muscle tone, a lack of tendon reflexes, twitching, skeletal abnormalities, and difficulty swallowing and feeding are some symptoms that other children may experience. Many of these children pass away before turning 2 if they are not treated. Type 2 SMA. SMA type 2 is usually first observed between the ages of 6 and 18 months, and kids do not need assistance to sit, but they need assistance to stand or walk. Children may also experience respiratory issues. Although life expectancy is lower, the majority of people survive into adolescence or early adulthood. SMA type 3. The Kugelberg-Wellander disease, another name for SMA type 3, is diagnosed after the age of 18 months. Though they may struggle to run, get out of a chair, or climb stairs, children can walk on their own. Spinal curvature, contractures, and respiratory infections are possible with additional complications. Most people can live average lives if they receive the right care. SMA type 4. After the age of 21, mild to moderate leg muscle weakness and other symptoms are the hallmarks of SMA type 4. But how is spinal muscular atrophy diagnosed? Certain symptoms of SMA are similar to those of neuromuscular diseases, such as muscular dystrophy. Your healthcare provider will take a medical history and conduct a physical examination to determine the cause of your symptoms. To diagnose SMA, your doctors might need to prescribe one or more of the following tests. Blood tests. An enzyme and protein blood test can be used to detect elevated creatine kinase levels. This enzyme enters the bloodstream through deteriorating muscles. Genetic test. This blood test detects SM1 gene abnormalities. Genetic tests are 95% successful in identifying the mutated SM1 gene as a diagnostic tool. In certain states, routine newborn screening include an SMA test. Nerve conduction test. The electrical activities of muscles and nerves is measured by an electromyogram or EMG. So, is SMA curable? There is no known cure for SMA as of now. However, SMA patients can improve their quality of life by managing their symptoms and avoiding complications by working with their healthcare providers. The following approaches could be suggested. Medication. As of now, spinal muscular atrophy cannot be treated with medication. Clinical trials are currently underway for a number of drugs that aim to enhance nerve and muscle function. Braces, support devices, and wheelchairs. For as long as possible, these can assist patients in keeping their independence. Ventilation assistance. Individuals experiencing respiratory problems might benefit from non-invasive ventilation to avoid sleep apnea, and some might also require assisted ventilation during the day. People of any age can suffer from an extremely complicated and incapacitating disorder known as spinal muscular atrophy. Everyone has a responsibility to consider and meet the needs of those who are impacted because we are social beings. Let's work to encourage them as they progress towards empowerment and resilience. If you would like to receive more information similar to this, please subscribe and share your insightful opinions about SMA. Click on the links in the description to learn more about SMA. Until our next meeting, goodbye.